Hi guys, so British care homes have had a very difficult 2 years. First, they were in the firing line when it came to the pandemic, having to deal with an inundation of cases due to elderly people being transferred from hospitals to them. They were also at the back of the queue when it came to PPE, and now they're struggling once again. However, it's not some microscopic threat. No, the fault in this case is completely the work of men and women, Brexiteers to be exact. Care homes are the latest victim to suffer staff shortages because of Brexit. A northern Somerset care home that employs about 40 staff is under extreme pressure at the moment. Maria Care's director Barry Edwards told the media that the centre needs another 20 carers, but it has been a nightmare finding people to fill those vacancies. Like many other sectors that rely upon EU nationals, the care sector is feeling the pinch. The response from the Brexiteer government has always been the same: invest in UK workers. Of course, the problem with this is that it takes time and money to replace foreign staff with homegrown workers. The government has said that they're planning to pump £36 billion into health and social care in the next 3 years. A spokesperson for the Department of Health and Social Care said, and I quote, "We are working on health and social care reform to ensure that we can provide world-leading services and are committed to learning lessons from the pandemic with a full public inquiry in the spring. But that's doing nothing to help care homes struggling now." The director of the Maria Care facility told the media that in 2016, 1 in 3 applications for a job in the care home arrived from the European Union. That has completely fallen away since Brexit and has created a real issue for recruitment. The director of the care home said, and I quote, "And of course the population is aging, so more and more carers are needed every year. It just makes life very difficult because there are about 6,500 jobs in care just in North Somerset alone, and there's about a 10% vacancy rate." The lack of available staff for care homes is having a knock-on effect in hospitals. Many patients are now remaining in hospital as there's no bed available for them in the community or in a care home, which is causing real problems for the NHS as we get closer to the peak of the winter season, a time when the NHS is under its greatest strain. At the moment, for example, 1 in 4 hospitals at Southmead Hospital in Bristol is occupied by somebody who could be discharged but cannot leave because there isn't enough support available in the community. Dr. Peter Brindle of the North Somerset and South Gloucestershire Clinical Commission Group told the media that about 1,500 vacancies currently exist in the care sector in his area. He said, and I quote, "There's an enormous number of people that we would have normally supporting people out of hospital. While the government expects the care sector to just attract staff with higher wages, that isn't going to work like it has worked with heavy goods vehicle drivers. Care homes operate on an income from the council, so if local government isn't paying enough for placement, then care homes will not be able to hire the staff they need to care for incoming patients. Somerset Council, for example, pays £670 per month for a residential care placement, but care home owners told the media that there wasn't enough for them to pay the minimum wage for workers." The director of a care home in Weston-super-Mare said of this problem, and I quote, "It has been quite an effort to fill vacancies, including those on maternity leave. Other nursing homes are struggling to fill vacancies. I think it's partly to do with Brexit, and I think it's partly because of the economy recovering from the pandemic." We can add this to the growing list of sectors impacted not just by Brexit, but the type of Brexit that the likes of Boris Johnson and Priti Patel wanted. While supermarket shelves are something that the general public will be faced with, the lack of care staff to look after the elderly and others who require assistance will not be something most people will have to confront, at least on a daily basis. The fact that the government is in no way inclined to deal with this problem means it will continue to worsen over time. While destroying some industries is Brexit by design, I'm afraid to say that social care is being destroyed through neglect. Brexiteers can ignore the problems facing social care because the public don't care enough about it. Sadly, the lack of staff available will mean more pressure on those who are still working and more cost and corner cutting in order for many care homes just to stay afloat. A short-term solution to this would be to provide visas of 6 months to 1 year. Long-term solutions would require massive investment in training and higher wages for care workers. The government could achieve this if they wanted to, but they would prefer to see it fall apart and allow the private sector to pick up the pieces. This would mean only those who can afford such care would get it. None of this was necessary. If freedom of movement was reinstated, the UK would once again have access to the carers it needs. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.